Good evening, everyone, and welcome to everyone who is joining us across all the social media platforms of the Ministry of Health and Wellness. Today is recognized as World Cancer Day, and we're going to have a very special and pertinent discussion about cancer prevention, screening, and control. I am your moderator, Dr. Sarah Lawrence Lewis, and along with my esteemed panelists, we're going to raise the awareness of cancer, provide you with information about prevention with special note on screening, and offer support as many of you out there are affected by cancer either personally or relationally. We want to confirm our personal affirmations as we all need to do our part in the fight against cancer. We're going to start with a pledge from our very own Minister of Health and Wellness, Dr. the Honorable Christopher Tufton.
Hi, I'm Chris Tufton, Minister of Health and Wellness. I will ensure that the ministry works towards quality health care for persons affected by cancer, as well as strengthen comprehensive policies that impact their daily lives. I will take concerted, positive action to reach the target of reducing premature deaths from cancer. This is my pledge. What's yours?
I would like to applaud the pledge of our minister and also the commitment of the Ministry of Health and Wellness. I would like to welcome Dr. Nicola Skyers, Acting Director, Disease Prevention and Control in the ministry. She's also Project Manager of Non-Communicable Disease and Injury Prevention in the unit of the Health Promotion and Protection Branch of the Ministry of Health and Wellness. Welcome, Dr. Skyers.
Thank you so much. Thank you so much. So the Ministry of Health has found it a very necessary time for us to start and escalate our conversations around cancer and cancer prevention. What we have realized is that our top 4 cancers, prostate cancer, colorectal cancer, cervical cancer, and breast cancer, are all cancers which are amenable to screening to ensure that we detect these conditions early, and therefore we would be able to have better outcomes for persons who are diagnosed with these conditions. So it is the ministry's thrust to ensure that we raise awareness, as well as ensuring that persons are aware that treatment is available so that we can have a reduction in the number of cancer-related deaths in the country. So it's really very important for this session to bring that kind of awareness to the population so that we're able to reduce the impact of this scourge on Jamaicans.
Thank you very much, Dr. Skyers. And it is clear that as we raise the awareness of cancer in our country, we'll see the ripple effects positively throughout our nation. So with no further ado, we're going to move and open the floor to our panelists for this evening's presentation. It is my pleasure to introduce my schoolmate from my alma mater, Immaculate Conception, Dr. Danielle Smelly. She's a consultant hematologist and oncologist. She heads the Hope Institute of Jamaica and is the lead oncologist at KPH, the Kingston Public Hospital Breast Oncology Service. She will be speaking to us about your role in cancer prevention, my role in cancer prevention, our role in cancer prevention. Dr. Smelly.
Good night, everyone. Thank you so much for that warm welcome, and thank you to the organizers of this event for inviting me to speak this evening. So, as Sarah said, my topic is cancer prevention and control. Now here's your role. When we talk about controlling cancer, we're really talking about 2 big things: cancer prevention and cancer screening. Cancer prevention refers to the things that you can do to reduce your individual risk of cancer. In general, when we talk about an individual's risk of cancer, we're referring to 2 main groups of what we call risk factors. There are things that are non-modifiable, which are also called things that you can't really change. And that includes your age, your sex, your ethnicity, and your family history. These all inform your cancer risk, but there isn't much that you can do about them. So what can you do something about? The things you can do something about are called your modifiable risk factors. And those include things like a healthy diet, ensuring that it includes fresh fruit and vegetables, maintaining your exercise, maintaining a healthy weight, limiting your alcohol intake, and of course, avoiding smoking. Now, when we talk about your role in preventing cancer, the first thing that you can do is say to yourself, am I eating well? Am I exercising regularly? Is there more that I could be doing to ensure my own health? And if you're not sure, have a seat with your general practitioner and ask them, is there a role for me to see a nutritionist to get more advice on my diet? What's the best way for me to start an exercise program? The first step to preventing cancer is for you to advocate for your own health. Now, the second thing we need to talk about in cancer prevention is vaccination. Now, vaccinations are a crucial part of preventive medicine in general, but they have a particularly special role when it comes to cancer. There's a lot of research being done trying to develop a general cancer vaccine, but that is still some years away. But there's one cancer in particular where much progress has been made, and a vaccine exists and can lower your risk of cancer. The vaccine is for HPV, the human papilloma virus, also known as the virus that causes cervical cancer. I would advocate for all women to have a conversation with their doctors about the HPV vaccine because it can do wonders in reducing the risk of cervical cancer. Now, although prevention is incredibly important for staying healthy, it is not the only thing that we can do to advocate for ourselves. We can also participate in screening. Now, cancer screening refers to tests that one takes in order to detect a cancer as early as possible. The top cancers in Jamaican women are breast cancer, cervical cancer, and colon cancer. And the top cancers in Jamaican men are prostate cancer, lung cancer, and colon cancer. And although these cancers are not good news, the good news is that there is screening for every single one of them. Done regularly, a screening test gives you a really good chance of finding your cancer early. And of course, I don't need to explain that the earlier you find a cancer, the easier it is to treat. And the easier it is to treat, it means that you are more likely to survive your cancer. In addition to that, detecting a cancer early also means that you may not need very invasive surgery to get rid of it, and you may even be able to avoid chemotherapy. This gives you a shorter recovery time, more time with your loved ones, more time at work. And so altogether, detecting a cancer early is more affordable than treating a cancer when it's advanced. So screening is better for your health, it's better for your time, and it's good for your pocket. So if you're a woman over 40, you need to get your mammogram every single year. If you're a woman who is sexually active, you need to have regular pap smears. If you are a gentleman over the age of 40, you need to talk to your doctor about your prostate. You need to talk to them about a blood test called the PSA. And if you're a smoker, the best thing you can do is quit smoking. But you can also have a conversation with your doctor about the role of low-dose CT scans to screen you for lung cancer. When it comes to colon cancer, there are a variety of screening tests, and they range from more affordable and pretty easy, checking the stool for things like blood, and to the more costly, slightly more invasive tests like colonoscopy, but those give us more information. There's a wide range available, so again, I encourage you to sit down with your doctor and have a talk about the test that's right for you. Now, this is a very extensive topic, and it would be easy for me to keep going, but I'd like to wrap up by saying that when it comes to cancer prevention and control, your role is threefold. Eat a proper diet, exercise, and avoid things like smoking. Get your vaccinations if you are eligible, and maintain regular screening. Do your mammograms, your PSAs, and your pap smears. Thank you very much for your attention this evening. Maintain your health.
Thank you very much, Dr. Smelly. So a lot of persons gave their questions over the weeks leading up to this event, and I have two here for you before we move on. There's some apprehension about getting the cervical cancer vaccination. Could you speak to that, dispelling some of the myths, encouraging our population to encourage our girls to uptake the benefits of the vaccine and some of the risk factors that people need to not worry too much about?
So this is actually a very, very common concern that people have about vaccinations, particularly within our current climate. And it's important to know that, one, this vaccine has been incredibly well researched over many, many years, and there's copious amounts of data to support not only its safety, but how well it works. So that's one. Two is that it helps to prime your immune system to clear the virus. And once you get rid of the virus, you cannot get cervical cancer. For a disease that is so prevalent in our population and so preventable, it is disheartening to see not just all women, but particularly young women, women who are 29 and 25, come not just with some cervical cancer, but with very advanced cervical cancer, and it's avoidable. So their quality of life is vastly compromised, and the vaccine can prevent that.
And this is right up my alley and
Yes.
everything that I'm passionate about. And if we increase the uptake, we can get what we call herd immunity.
Yes.
And in hopes of eradicating HPV
Altogether.
Another question before we move on. You spoke to screening. How does that change if you have a family member with cancer? Say, for instance, if I had a mother or a sister that passed away or was affected by breast cancer at the age of 30 or 27, does that change my screening schedule?
That is an excellent question, and it's an excellent thing to bring up. So the screening schedule absolutely changes because your screening is based on your risk. And that's the thing. That's why it's important to talk to your doctor about your individual risk factors. Breast cancer, as you brought up, in a first degree family member, so a mother, a sister, an auntie, directly increases a woman's risk for her own development of breast cancer. And that woman should start her screening 10 years earlier than the youngest age of the youngest affected relative. So if auntie had it when she was 35, you should start screening when you are 25.
Not at 40.
Not at 40, 25.
Absolutely. Yes. And we could talk about the genetic components, all sorts of things. The point is to start the discussion with your
Absolutely.
doctor tomorrow.
Tomorrow.
Right, today. Thank you very much, Dr. Smelly. We're going to move right along to Mr. Sanchez Palmer. He's a principal medical physicist in the Southeast Regional Health Authority, and he specializes in radiation oncology. He's going to speak about radiation safety and protection, but I know you're going to start with telling us about what radiation oncology is all about.
Well, I'll address it at some point, Dr.
All
Lawrence,
right.
but thank you. So I want to briefly discuss radiation safety and protection. And I think the ideal place to start is, what is radiation? So we all know visible light. Visible light is an electromagnetic wave. And in the spectrum of EM waves, we have some known quantities like the radio frequency, our microwaves, and something we can't live without, our Wi-Fi. At the higher end of the spectrum, we have X-rays and gamma rays, and these are the types of radiation that we need to be protected against. These radiation types are called ionizing radiation types because the energy they possess gives them the ability to cause damage to biological tissue. In 1895, a physicist by the name of Röntgen accidentally discovered X-rays, and through his discovery, he gave us the first medical image. It was the image of a hand. And as you might imagine, in the scientific community, it was quite a buzz. In the world, it was quite a buzz because for the very first time, we were able to acquire images of the body. Now, through the development of applications using radiation, there are three key outcomes that are important to us in cancer care and screening. One, diagnostic imaging. So your X-rays, your CTs, your fluoroscopy scans, your mammography scans, they're all byproducts of diagnostic imaging. So we pass an X-ray beam through the body and we obtain images. The second important development was nuclear medicine. In nuclear medicine, a radioactive source is introduced into the body. It emits gamma rays, we detect these rays, and we produce another type of medical imaging. Now, nuclear medicine is extremely important because it allows us to gain functional information. So it allows the radiologist and the oncologist to better able to delineate the tumor. And finally, radiation therapy or radiation oncology. And this is the treatment of cancer using very high energy beams. I want to highlight at this moment that Jamaica has 2 national cancer treatment centers, one at the Cornwall Regional Hospital and one at the St. Joseph's Hospital in Deanery Road in Kingston. And we offer to the public treatment in oncology using high energy radiation. I also want to highlight that the University of the West Indies in short order will be introducing a nuclear medicine facility to allow the public access to nuclear medicine images. Back to 1895. So we discovered X-rays and the world was excited about it, and the applications were being developed, It was so fascinating that shoe companies would offer you a free X-ray of your foot if you bought a shoe. But what we found out very quickly afterward is that there are harmful effects to radiation. So how do we utilize radiation, gain the benefits, and still remain protected? We need to put systems in place to allow us to do that. And that is the whole promise behind radiation safety and protection. So in medical physics, and as a medical physicist, we achieve this in several ways. First, we guarantee the integrity and the structural components of a building that would house a radiation generator or radiation source. So we perform shielding calculations of the walls. We ensure that we consult with manufacturers and engineers so that when the device gets here, the activities taking place within that building, within that room, will not affect the public on the outside. Secondly, there's acceptance testing and commissioning. So once the equipment gets here, we need to ensure that it performs in a way that we expect it to. It performs to international standards. And that's the process of acceptance testing and commissioning. Thereafter, we need to ensure that these standards that we have accepted, they're maintained over the lifetime of the equipment for clinical use. So on a routine basis, the medical physics team will check the equipment to ensure that the standards are being maintained. I want to ensure the Jamaican population that at our national cancer treatment centers, on a daily basis, the devices are being checked by physicists or radiotherapists to ensure that when you get there for treatment, the machine is in optimal condition. Another way we influence radiation safety and protection is through the monitoring of our workers. So if you're a worker in a radiation environment, we monitor the radiation dose that you would receive to ensure that you never surpass the tolerance limits. We also provide training for staff that utilize equipment that generate radiation. And finally, we implement emergency procedures. So in an unfortunate event of an unwanted exposure or an accidental exposure, how do we respond? And can we respond in a way that will mitigate the harmful effects? And in closing, I want to highlight 2 key stakeholders: the International Center of Environmental and Nuclear Sciences, that's ICENS at UWI, and they offer us TLD services so that we can monitor our workers. And finally, the HSRA, the Hazardous Substance Regulatory Authority. And what they do is they enforce Jamaica's Nuclear Safety Act to ensure that all facilities, public or private, they are regulated, and the services that they provide that utilize radiation are governed and follow international standards. So together with radiation safety and protection, we're helping in the fight against cancer.
Thank you very, very much, Mr. Palmer. So our questions about radiation and radiation therapy, we have some skeptics out there, so I'm glad that you've cleared up a lot of what persons are concerned about. Some people want to find out, can radiation therapy be used to treat all cancers?
It's a yes and a no. The decision to treat a particular cancer using a particular type of treatment will depend on the size of the tumor, the stage of the tumor, and the patient's history and conditions that might allow them to undergo radiation. So in radiation oncology, it is required that the patient be extremely still. There are devices that are used to help in this process, but if the patient is unable to do so, then they wouldn't be eligible for that treatment type. So the oncologist and a group of other professionals will decide what's best for that patient. It might be radiation, it might be another course of treatment.
Okay, and they also want to know, what are the side effects of radiation therapy and how long will they last?
Again, that's a question that varies from patient to patient. So the side effects, they'll be conditional. A patient with a tumor that is near to the surface of the skin might have side effects such as erythema or burning of the skin. A patient with prostate cancer might have some trouble using the bathroom for a few days after the treatment. So it will really vary from patient to patient, but in most cases the side effects are minimal if the operation is done correctly.
And the benefits should outweigh the risks. Because we definitely, no doctor should want to put you in harm's way. So they really shouldn't approach it with skepticism, right? All right, thank you.
In fact, it's recommended that at least 50% of all cancer patients should undergo radiation. Radiation therapy would be the best option for them, and we afford that service here.
Okay, thank you very much, and it's very good to know that all of this is available right here in Jamaica. So we've spoken about many of the biological aspects of the disease, but we can't deny the psychosocial aspects as well. Cancer affects the patient so intimately and deeply, not only them, the persons around them. So in order to take a holistic approach to this discussion, we're going to invite Ms. Keisha Bowler-Hines, Associate Clinical Psychologist, Coordinator of Counseling Services for the Liguanea region of the Southeast Regional Health Authority. She's going to speak about the emotional side, how your mind can help your body. I can't wait to hear this one.
Good evening, everyone. It is a distinct pleasure to be here. And I must commend the organizing team for including the emotions, because no human being is complete without us talking about our emotions. If we were to start with a discussion on cancer, it's easy for us to say, you are diagnosed with cancer, I am not. You are at risk, I am not. But if we were to level the playing field, we do that quite easily by speaking about our emotions, because each of us have emotions. So let's take a look at our emotions from a general perspective. First of all, what are emotions? Simply put, our emotions are our feelings. They impact changes in our thoughts, behavior, mood, motivation, attitude, and they even go on to impact our temperament. The list goes on and on and on. Now, usually there are different types of emotions, and the theories are endless. You have basic emotions, some of which include happiness, anger, sadness, anticipation, fear. The list, in the same way, goes on and on. I am sure that if I were to ask the persons in the room with us this evening to label one emotion, some persons are shaking their head, are saying they don't know the names, but after a while you will learn a few. Now, what are some of the characteristics of our emotions? Typically, we talk about how we feel. I feel this way or I feel that way. But really, our emotions have some characteristics that we need to learn about. The first thing is that our emotions change quickly from moment to moment, depending on our experiences, depending on where we are at any point in time, our emotions can shift. Our emotions can be managed. They're not always out of control, even though sometimes they do feel that way. Our emotions can be contagious. If we're in a room and we are happy, smiling, laughing, persons automatically shift in the way they feel as well. And last but not least, our emotions can be shared. The sharing part of the emotions is what many of us sometimes avoid. Now, who experiences emotions? Everyone. Males, females, patients who are diagnosed with cancer, patients who are at risk, supporters of cancer survivors, and the general population. How do we experience our emotions? Each of us experience our emotions and manage them differently. Some of us shy away from our emotions. We pretend as if we don't have them. But today, the secret is out. We all have emotions. Even if you say, oh, I don't have any, or I'm strong, it doesn't mean you don't have emotions. You do. Some of us embrace our emotions. Some of us express them freely. And believe it or not, there is a wider range from the person who shies away. Some people actually deny their existence. Who, me? I don't have that, I don't do that. But the truth is that emotions are always there, bubbling beneath the surface, just waiting to be expressed. Now, we can express our emotions in healthy or unhealthy ways. If we're expressing them in a healthy way, we're actually able to embrace them. We can be okay with where we are at, and we can acknowledge and accept that our emotions are there. We become okay with saying, today I feel sad, today I feel down. And in the same breath, a couple minutes later, we're able to say, you know, I feel a lot better, without feeling any guilt or shame from having a switch in your emotions or any concern that you are not being authentic. If we're expressing our emotions in an unhealthy way, then we deny that we are experiencing X or Y. We get our emotions pent up, and what do you think happens after our emotions get pent up? They actually explode like a pressure cooker. So sometimes we have an emotional meltdown, is a term that some of us may use. And sometimes that is due to the fact that we really have not been expressing our emotions in a healthy way. So why focus on the emotional side while we're talking about cancer? The emotional side of things actually helps to balance out this conversation. Once we talk about the physical, the medical, we have to speak about what we feel so that we can truly begin to take a treatment approach that is holistic. We really want to be treating not just an illness, but we need to treat the whole person. The person who is experiencing the challenge from the illness and the person who is experiencing the feelings related to a particular diagnosis. So the truth is that our thoughts, our feelings, our attitudes can positively or negatively affect the physical part of us. If we're feeling anxious, a doctor could do some tests and they would see an increase in our blood pressure. Our heart rate would increase. Those are actually objective signs that tell us we are expressing something emotional. How we experience that can also be subjective, because someone could say, I feel anxious, but those physical signs are not necessarily there. It doesn't mean that the person is not feeling what they say they are feeling. Now, why focus on the emotional? Why is this so important, and why am I so passionate about this side of things? The truth is that focusing on the emotions really targets patients, survivors, caregivers, and supporters. It brings us together in the fight against cancer. When we look at the emotional side of things, it helps us to determine how well we are coping. Are we really coping, or are we not? It helps us to determine whether or not we need additional help or support, which is not just purely medical. We may need to seek counseling support. We may simply need to strengthen the support system that we have around us. We may need to have an extra 1 or 2 caregivers in our space because our condition is so difficult. Or if we're at risk, we may simply need someone to talk to because we feel frightened or afraid that what has happened to one of our loved ones will happen to us. Focusing on the emotions will also help us to manage our day-to-day lives well. In fact, it helps us to manage our day-to-day lives better. The more aware we are of how we feel, it's the better we are to manage what we are called to handle on a day-to-day basis. The emotional side really and truly balances the conversation that we are having now, and it helps us to take a holistic approach to treatment, to managing persons at risk, to engaging with survivors after cancer, to addressing the role of caregivers and supporters. It helps us to increase our self-awareness, and it also more than anything, helps us to change the way in which we engage with persons who have been diagnosed with cancer, persons who have survived, or persons who are at risk. It also helps us to change the quality of engagement with the persons who are giving care to those who are faced with cancer. When we focus in that direction, we really no longer see a disease, and we no longer experience dis-ease when we experience situations of cancer, because we are now engaging the whole person. We identify with persons at a deeper level. No longer when someone comes in do we first see a cancerous growth, or do we see the diagnosis that is written on paper. What we see is a person like you or me who is contending with a challenge that any of us can be called to face at any point in time. It helps us to trust each other more. If we believe that it is okay to express the way we feel, if we feel that we can say I am sad or I'm happy without fear that others will believe that we're being untruthful, or without fear that someone is saying, hey, you know, you're not authentic. How can you have cancer and you smiling so much? If we are able to just be, then really and truly, it gives us a safe space for everyone who is in the conversation to truly be who they are and be the best that they can be towards each other. When we validate each other's emotions and the emotions of each other, we are able to really enjoy a higher quality relationship between each other. It strengthens relationships between family members, the community, and if the community is strengthened, then certainly so too is our nation. Thank you so much, and let us continue to work together in a holistic way to fight cancer.
Thank you, Mrs. Bowler Hines. So a question for you. We know when many persons are faced with unfavorable information or bad news, bad news is being broken to them. Yes. They go through a grief cycle. Yes. And some of the emotions they feel may be fluctuating, yes, but it's typical. Yes. Could you speak to the person who may be going through denial and it leads to somewhat destructive behavior of not seeking your cancer treatment or so? Because a lot of times we see a patient, they don't believe it, they go off to probably try something natural, or they just don't accept it, and then they come back at a very later stage when we can't really do much for them. Speak to addressing the person on an emotional level if they're going through denial.
Okay. So one of the first things to recognize when someone is experiencing denial or simply is not meeting us where we are at in terms of the diagnosis is for us to meet them where they are at. So quite often we try to say, this is the fact, this is the truth, you need to accept this information. What if we were to flip the script a little bit, and instead of getting them to understand the diagnosis, we begin first to understand where they are at. Why is this condition so difficult for you to accept? What may be happening that prevents you from really accepting that this diagnosis is what it is and it is here? The truth is that many of our families who are diagnosed may actually have family. They may have children that they are caring for. They have lots of business that they need to take care of. And if they get sick or admit to being sick, it means that a lot of the things that are high on their list of priorities really and truly cannot be addressed. So if we can meet persons there first, then it becomes a lot easier, because the person will feel understood and will be at a better place to hear and receive the information that you are trying to pass on to them.
Thank you. Finally, when would a family member or even a person should deem what they're feeling as inappropriate? Because yes, you're going to go through shock, sadness, denial, but is there a length of time where they're saying, okay, this is now inappropriate, I need to go and seek help from a counselor or seek help from a psychiatrist to help deal with the emotional aspect of my condition? Could you outline that to help us all in that management plan?
Sure. So the first thing is that our emotions are never inappropriate. Whatever we feel is what we feel. And the first step is to validate, I am down, I am sad, I am angry, I am lonely, I am upset, I am frightened, I am scared. If we are able to acknowledge that we are feeling what we are feeling, then the next step is to really determine if what we are feeling inhibits or prevents us from functioning well. Whether or not what we are feeling stops us in terms of doing well. Are we getting along in our relationships? Are we functioning well at work? Are we still executing our day-to-day tasks well? Are we still maintaining good social relationships and friendships? If those areas begin to decline, those are usually excellent indicators that we need to get in some additional support. Let's get some help.
Thank you very, very much, Mrs. Bowler-Hines. So Dr. Smelly drove home as one of her top 3 things that we should all engage in screening. Luckily, the Ministry of Health and Wellness got all of these areas covered, and we have some participating screening entities who pledged to do their part as well. We would love to thank the Woman's Place, Jamaica Cancer Society, Apex Radiology, Radiology West, and People's Medical Lab who have joined with us. And we want to encourage all of you to take advantage of the subsidized rates and all of the offers that they have going for this month as they partner with us, to partner with you to get the discussion started and get screening started as well. We also encourage you to follow our social media pages or contact them directly to hear a little bit more about the screening deals that they're offering. We also have special thanks to our telecommunication and media partners who facilitated us getting the word out tonight. Digicel, Trend Media, Loop News, and other partners who pledged to support this mandate as well. The Social Development Commission, NCB Group, Jamaica Cancer Society, the Gleaner, and the Jamaica Information Service. Now, cancer has impacted each and every one of us in some way. It is the inspirational words from our survivors, however, that give many the power to combat this disease. And they also encourage us to prevent and screen for a better outcome. Mr. Quinton Yerde is no exception. He is among one of our brave Jamaican cancer warriors. And even in his fight, he is pledging to do his part.
I am Quinton. I am an advocate. In 2018, I was diagnosed with prostate cancer. In 2019, I did the radical prostatectomy. In 2020, I did radiation. The experience has taught me that I need to share my experience. So I will continue to share with men my journey, because early detection is the only way that we will stop prostate cancer from being the largest killer of men in Jamaica.
As you can see, Mr. Yerde is a very passionate advocate of prostate cancer. This 50-year-old lecturer has been aware of his risks since his very own father was diagnosed with prostate cancer. He did his regular clinical checkups, he did his blood tests, and as soon as an abnormality was detected, he sought out further treatment. Unfortunately, he got the diagnosis of prostate cancer, and he's here to share his story with us. Welcome, Mr. Yerde.
Thank you. Thank you. Well, go on, Jamaica. So let's tell you my story. So I I had a fluctuating PSA, and it would go up, it would go down. My oncologist at the time, urologist rather, did an MRI, it was clear. My DRC was clear. He said, well, let's do the biopsy. My biopsy proved that I had prostate cancer. Interestingly, it was 30%. So he said, okay, I'm going to give you some weeks to decide what your treatment is going to be, whether radiation or surgery. I had had a brain tumor at 14, and I had removed it, So I wasn't keen on the radiation thing at all. Not interested in that, none at all. But in the end, I still had to do radiation. And the reason why was after they had done the surgery, and my philosophy was, listen, if I take it out or if I radiate it, it still don't have no use. So why am I keeping something in me that don't have no use? So take it out. So we took it out. But one advantage for me was when they took it out, they take out the prostate and they take out your seminal vesicles. The cancer actually had exited my prostate and had gone into one of my vesicles. So when they saw that, they're like, whoa, you're going to have to do radiation. So you can't do radiation immediately. So 6 months after, I'm proceeding to start radiation. They do my baseline scan. They find 4 nodes that weren't there before. So, yeah, I eat this now. So the radiologist who saw me at the time wrote biopsies or PSMA MRI. But 3 of them could not be accessed by a biopsy, only 1. So that leaves PSMA MRI. So I called the place and said, yeah, I need to do a PSMA MRI. They say, excuse me? They said, we don't do that here. I said, I mean you don't do that here? Well, we have the machine, but it's not approved yet. I said, what? So I called the world. I called America, England, Canada. It's not done. It's actually on trial in America. And I could get a trial, but if you know anything about trial is hit or miss. You don't must get it. Long story short, I had a friend in Germany, and I was there saying to him, those are skirt. I got dead for cancer. I need to do this test, and nobody, we can't find nobody to do it. And he said, well, it was a she. She said, let me check. It's actually the standard of care in Germany. Now, I had been to Germany several years before. So I said, find out if you can get me an appointment, because my attitude was simply this. Whatever it is that I could do to help my cancer fight, I would do. Wasn't thinking about cause. If I have to sell my car, I sell it. It didn't really matter to me. So, long story short, the PSMA MRI, which is what the gentleman here says Yui is about to have. Yay! Sad story. When I had my brain tumor, we never had CAT scan machines in Jamaica, And I had to go away and get a scan done. When I came back, we now have CAT scan machines. So it's good. We're going to get nuclear machines. And that's the standard of care that we need to get, especially for cancer treatment. So long story short, I get to Germany, they do my test, and they find out that my nodes are, well, 3 of them are okay. 1 of them was inconclusive. They wasn't sure what it was. So I had to now come back to Jamaica, show the results to my doctors, and they now make a call. Whether we're going to radiate or we're going to give him chemotherapy, what we're going to do. So I pretty much created a panel. So I went to 5 reputable doctors and got their opinions, and in the end we decided to do the radiation and monitor. So now I'm being monitored and everything is good so far, right? So that's, in a truncated way, a very difficult story, because when you're going through it, it's not like this. Having a cancer diagnosis is nothing like what we have heard here. But I'll say this: you must live. You must understand that a diagnosis of any illness is just a challenge that you have to try and overcome until you can't overcome it anymore. Because when you can't overcome it anymore, that means you're dead. So a diagnosis is not a death sentence, okay? What you need to do is play it like a game of cards. Okay, what's the best thing for me to do? So it goes to things like, okay, if you're going to the doctor, go with somebody else. Because everything the doctor is saying, you are not hearing. The other person that is there, their job is to write it down. So that when you go home and you start, and they can say, well, the doctor said this, 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 this. But many persons, they don't get a plan together. They don't get a team together. So they don't share it with positive friends. I was fortunate because I'd had the experience of the tumor at 14. I was a little used to this. So my wife and I, she's like, oh my God. I'm like, watch the ride. Why? Because I'm going to show you how to ride now, but there's going to come a time when I can't ride. And the night of the surgery, gave her my phone and I say, you're up. And then every time a challenge occurred, my wife was there, riding. But we had set our plan in motion. We had gotten some close friends. It is important to have positivity. So I'm talking about this now, but one of the biggest things is secrecy. When somebody is ill, because it's so personal and private, people don't talk about it. You know why? Because, in Jamaica, they say, what, you're dead, man? You don't need to hear that. They say the most inappropriate things. Sorry, madam, it's not that. They feel that way, but gosh, you don't really want to hear that then, eh? But they say it anyway, and sometimes you say, you couldn't just keep your mouth. So I was very selective with who I told. I told my in-laws, my close family. I told the friends of the parents of my son, who was 6 at the time, his friends. I told my wife's closest friends, and she would have told them, but I told them. And I said, listen, you know why I'm telling you this? Because I want you to be there for her. Say, don't worry about me. I will sort out. And for him. So it is important for you to get a team together when you're facing a serious illness. Also as well, you need to inform yourself. So I would have questions to my doctor. And I would ask him some serious questions. And I was fortunate with the doctors that I had. They'd say, okay, here is a resource that I think would be useful for you. So I'd go and I'd read up. I am fortunate, a couple of my friends are in healthcare, so they were a part of my team. So I'd call them and say, hey, this is what the doctor is saying. And I say, that sounds good, But what about this? What about that? So one of the things that is very useful is a second opinion. Just because the doctor says X or Y, if you have a concern and the doctor not addressing the concern, or you don't feel you can, no problem, go see another one. And then you put the two opinions together. Why? If you're in a hospital and you're sick, does one doctor come and see you? Even in a Jamaica hospital, you're sick, one doctor comes see you, then another one will come, and another one will come, and they all have to agree on your treatment. That's better for you. But when you go to a doctor privately, you might not get that. But you see, when you're facing something major, it is important that you get a second opinion. Another thing that helped me in my journey was paying attention to nutrition. Couldn't eat the big cartwheel dumpling them and the whole heap of food. We pretty much went pescatarian, and that means we did start just eat fish, stop eat white rice, sugar, lots of stuff we just stopped eating to help the body. They say with prostate cancer, what is good for the heart is good for the prostate. So that means what you're taking in needs to be good for your body. And that's not only for prostate, that's for any sickness, So maybe we can stop eating fast food, maybe. The thing with me that helped me was that my dad had experienced prostate cancer. So he could have given me insights that my doctors weren't necessarily giving me, because he could say, oh, well, this is going to happen to you. And I found that was very useful. So when I was laying in my hospital bed, and my surgeon came in and he said, boy, everything is good, you know. And we got into this conversation, and he pointed out to me that prostate cancer killed the most men in Jamaica. And I was like, you're kidding me, right? He's like, yeah. And he's like, men don't talk about it, it's taboo. I was like, nah. And in my head, a voice said, you know, you're going to be fine, but you're going to have to go tell your story. And that's why I tell my story, to help men, to help anybody with major illnesses understand that you're not alone. If you detect it early, you can actually do things to improve your quality of life. That maybe if you remembered that your uncle twice removed had died from prostate cancer, you would have said, hold on there, hang on a minute. I actually have the genetic line in my family, or your grandmother had died from cancer or something. So these are things that you guys have got to start realizing. Cancer is not a death sentence. It can be prevented by you making informed choices. And in the world that we live in, there is a lot of information available that can empower you, yeah, and perhaps prevent you from becoming one of the victims to cancer.
Thank you so much, Quinton. You just give it to us straight. But before you go, I want you to talk to the Jamaican man, because you took the initiative
Right.
to do your test.
Right.
A lot of them are not doing their
No.
test. And sometimes the test is not so culturally acceptable, right? One of the tests, the clinical test. But we know that the benefits of screening far outweigh any other discomfort or social, hang up someone may have. So speak to the Jamaican man as we close out this segment.
Check me now. Doc put it nice. She said, culturally acceptable. I cannot understand how a medical procedure can be compared to something that is supposed to be pleasurable, or it's a medical procedure. It's done for a medical reason. Therefore, men, one of the things you really have to understand is that you see how doctor there spoke about girls having to go and do their pap smears and their mammograms. What it means is that we have been done a disservice. Because when they used to say that, they never used to say, men, go do your prostate exam. Because that's really what needs to happen. Because if you don't know this, one of the things them say about prostate cancer is this. It's not if, it's when. So although the figures say, oh, how much men get prostate cancer, how much men die from prostate cancer, there are a lot of men suffering from prostate cancer who will never go to surgery. Because your PSA is a score that you will have from you are boop all the way up. And it grows with you. So it might be 1 when you're this age, 2 when you're that age, 3 when the next age, and so forth and so on. The problem is when it spikes. It's supposed to be 3 when you're 30, and it's 7. That means you have a problem. So what men now have to understand is, it's like how you service your vehicle, you have to service you now. And this thing where you say, boy, you want to see, man or her. Yeah, even car need an oil change, you hear me, Dan? Even car need tire. So at least we can go to the shop and get the tire and the oil. You can't get a prostate. You can't get a brain. You can't get these things. So it is important for you to ensure that they do not get defective. That's what needs to happen. So one of the things I go and I tell men, I see men in the street and I say, you do your PSA? They must say, what you talking about? Say, how old are you? 45. I say, you ever do your PSA? No. What that? I say, it's just a little blood test. You need to do it. And then I tell them my story and they say, for real? I mean, like, yeah. So, men, this thing about boy, you know, go doctor, because if you go doctor, you might go find something wrong. You need to start listening to your bodies. And if something is wrong, you need to go and deal with it, because you were dead. Remember 2 things, you know. You're born, you're going dead. 2 things. That's it. So how you live your life, you control that. What you put in your body, how you go to the doctor, you know, that's what you need to consider.
I couldn't say it any better than that. Thank you very much, Mr. Yerde, for sharing your story. It's very inspirational, and I know the men are going to get up and get out and start screening because of your wise words. Special mention to all those who shared their pledge this day, and they can be seen on our social media pages. Our survivors: Miss Maria Taylor, Miss Beverly Wallace, Miss Ethel Walker McIntosh, Miss Juliet Davis. Others also happily lend their voices to pledge: I am and I will. Dr. Patrice Charles, CEO of Phoenix Counseling Center, Miss Nadine Malloy, Principal of Arden High, Miss Casey Kerr, CEO of Parenting Support Commission, Miss Talia Suarez, Attorney at Law and Media Personality, Miss Sandra Samuels, CEO of Total Male Club and Spa. I know Miss Samuels will tell everybody about all the men that must do them PSA when she see them tomorrow. Mr. Orvin Hill, Minister without portfolio in the Ministry of Economic Growth and Job Creation. Mr. Michael Leslie, Acting Executive Director of Jamaica Cancer Society. So we're going to wrap up soon, but we're just going to throw to our panelists, you know, some questions, because as I said, we've got many questions. We can't address them all, but many to our oncologists especially. But anybody who can answer, please join in. Some people want to know how cancer treatments may affect their ability to have children.
Oh, that is an excellent question. So a lot of the treatment, well, first of all, let's talk about the different aspects of cancer treatment. Very often we can break it down into surgery, chemotherapy, which is the medical part of it, it's medicine for your cancer, and then radiation therapy. The part of it that I deal with mostly is the medical part, which is the chemotherapy, and very often that can impact your fertility and your ability to have children, particularly for our younger women who are developing breast cancer. So it is a part of our conversation at the time we're discussing treatment, is to say, what are your desires? Have you completed childbearing? Do you want more children? Because we do have fertility sparing options in Jamaica. We have, you know, in vitro, we have oocyte preservation. All of those things are available here and they're accessible. So we make sure to point that out and include that in our discussion, because it's not just about what we're doing now, it's about the life you're going to live when we're done.
All right. Okay. Sanchez, people want to know, how is it this thing that can cause cancer help cancer? Could you very simply explain to us how on one hand it causing the cancer and on one hand it helping the cancer?
That's a very good question, Dr. Lawrence. So radiation does not discriminate cancer tissue or healthy tissue. How we achieve the goal of eradicating cancer while sparing healthy tissue is part of the function of the medical physicist. So we plan, it's called a treatment planning process, where we ensure that we choose the best modes of delivery, the best angles for introducing the beam. And we ensure that the dose is calculated to each organ to ensure that the tumor receives the maximum of the dose and the organs at risk receive the minimum of the dose. And if we're able to achieve that, then we will have a result where the cancer is eradicated, but our healthy tissues are spared.
Okay, Mr. Yerde has a...
I'd just like to add to that, the PSMI, what it does is they use nuclear, so it's, so they use, let's call it nuclear juice. So they tailor this juice that likes prostate cancer cells, or that your prostate cancer cells like, and they inject it in you. Now when they inject that in you, anywhere there is prostate cancer, it will glow when they put you on the MRI table. So it's interesting what he's saying, because what they did with that one, this is how they're using now radiation positively, if that's the word, and nuclear positive, their body here, nuclear, blah, blah. So when they put that on you and they image you, it shows you where all the cancer deposits are in your body. And then they can targeted treatment. So you probably wouldn't even have to do surgery per se, because they could just use that same machine and do it.
All right. So I like this question because of its simplicity, and it also speaks to the multidisciplinary approach that we all speak about in medicine. It was, who are the doctors that deal with cancer treatment? If you were to Google it, you'd probably think simply the oncologist, but we see it's a whole wide range of doctors. Just put it out there so people know all the persons that are involved. Because as Mr. Yerde say, it's a whole lot of people collaborating in the treatment.
So you are quite correct. I mean, it's going to start from your general practitioner and their role as the person that screens you and encourages you to get checked and get tested and go through those initial results. So that person is involved. Then you have the specialists. You have surgeons whose job is to say, can we remove this? Is this something we can physically cut from your body? Then you have the oncologists who are going to talk to you about what medications can we use to prevent this from coming back. And then you have the radiation specialists who are also going to look and say, well, it's been removed, but there's more we can do to stop it from coming back to this area. Right. But that's just the medical side of it. We also have to remember that our nutritionists are very important in terms of providing advice for how can you nourish yourself and be as healthy as possible for your diet while you are on treatment, and how do you continue that when you're finished. Our counselors are also incredibly important, because this is a life-changing thing that people go through. And so it really is a team effort. It's a collaborative effort that goes outside of just medicine to involve every single aspect of the health management team.
Absolutely. Keisha, we're going to be wrapping up soon, but as a doctor myself, I have observed persons who are faced with the diagnosis of cancer, and based on how their emotions and how they take this information and their will to survive, you see how their diagnosis plays out. So could you explain, or even just give a little hope to someone who is facing this situation, how they should face it, what they should do, and infuse a little bit of that willpower to live and press on in the face of all of this?
Well, the first thing is to decide what it is that you want. You have the choice to be the best that you can be in any given moment of any given day. You can get bad news. You don't have to respond badly. You can still respond in a way that ensures that you are the best that you can be to yourself. Because if you are not great to you, then you can't be great or wonderful to anybody else.
That's right. Well, guys, it has been such a wonderful, informative evening. Thank you so very much for giving of your time and your expertise. We want to really now push it and drive it home to you at home. We're going to paraphrase what Dr. Smelly said. Firstly, we need all of you to activate screening. We're going to talk now about our partners who are going to help with this screening mandate. We have the Women's Center. Hold on a second, I have all of them right here. The Women's Center, Jamaica Cancer Society, Apex Radiology, Radiology West, and People's Medical Lab. All of these persons have partnered with us, and they're giving out subsidized rates and all sorts of deals for everyone in Jamaica to now get up, get out, and get screened. We also need you guys to do some research. We talk about the cervical cancer vaccine. I don't even, if I start talk, we don't finish tonight about that. I want everyone to consider it, read up about it, know about the benefits. It really is heartbreaking to see our young women dying from something that is actually treatable. We need you to cultivate a positive spirit. Embrace the emotions. It is a part of you. It's a part of the healing process. We need you to become conscious about your lifestyle choices. Right now, start exercising, start eating healthy, stop smoking, stop drinking. All these things you're investing in your health in the future. We need you to be your own health advocate. I am Dr. Sarah Lawrence. I will do my part in this fight against cancer. I will screen. I will encourage my friends to screen. I will use every moment of my academic and personal and all of life helping to promote this cause. What is your pledge? We want to hear about it. We want you to at us at the Ministry of Health and Wellness social media pages. Post, let us know what you're going to do today in the fight against cancer. Thanks for joining us. Have a good evening.